Well, hi everyone. It's nice to have you. Thank you for joining us. I just want to do a quick welcome. My name is Elizabeth Topper. I'm an epidemiologist by training and a faculty member here at the Bloomberg School of Public Health in the Department of Epidemiology. And I also serve as director of the MAS programs. And so I'd like to welcome you today. We're really excited to be able to talk about the program, answer any questions that you might have, and give perspective even better than we can of those who've been through the program. So I will turn it over to Dr. David Baker, Director of the Population Health Management Program.
Great. Thanks so much, Liz. And thank you all for joining today. In particular, thanks to Becky Vest and Steve Simchak, who joined us, a first and second year student currently in the program. So to introduce myself, I'm David Baker. I'm Executive Director of Population Health at LifeBridge Health, a large nonprofit health system here in Maryland. I've taught in Johns Hopkins Masters in Population Health Management program for over 5 years and now serve as co-director for the program. So as I mentioned, we have with us today Becky Vest, first year, and Steve Simchak, a second year student. And really they're here to share their experiences in the program and then help answer any questions you may have. So what I thought I'd do is, we could spend the first portion of this time together and hear from Becky and from Steve. So why don't I go do this? Why don't I ask Becky and Steve to introduce themselves and tell us a bit about their professional background and why they started exploring graduate programs at this point in their career. So why don't we start with Becky?
Hi, everybody. So I'm Becky Vest. I'm a registered nurse and I live in Milwaukee, Wisconsin. I attended the University of Wisconsin for my undergrad. And I've worked as a nurse in Milwaukee for just over 15 years. I started at bedside for medical surgical, working at St. Joseph's Hospital in the center of Milwaukee, serving a lot of disadvantaged individuals. In Milwaukee, we have a lot of problems that are related to social determinants of health and, health disparities. And so I had a front row seat to that. And then I moved into community case management for individuals on a Medicaid waiver program, where I worked with individuals with intellectual and physical disabilities. And then also my most recent or current role is in a newly formed population health team. But before that, it was transitions of care from hospital to home for an HMO. It's Molina Healthcare, and we work with members who only qualify for Medicaid, so they could be Medicaid or dual eligible. So also working, with individuals who qualify for Medicaid, and with that also comes a lot of unmet need. And so at this point in my career, I've seen a lot of the different programs and a lot of the community services that are offered within my community, but I see the silos. And so I wanted to find a program that would help give me the intellectual and educational chops to be able to start working on some of those problems here in Milwaukee.
Excellent. Thanks so much for sharing that. And Steve, how about you? Tell us a little bit about yourself.
Yeah, thank you. So I'm Steve Simchak in my second year in the program here, and before coming to Bloomberg, kind of had a peripatetic career path. Have a bachelor's in biology, a master's in environmental management, but really, for 18 years, I've been doing health IT mainly for the federal government at the National Institutes of Health, the Veterans Health Administration. About 4.5 years ago, I left that space, and I'm now doing health IT in biopharma at Merck, and based out of Southeast Pennsylvania. And I've always thought about science and medicine, but I wasn't a very good microbiologist or wet chemist, and definitely couldn't be a bench scientist. So I always tried to be involved in that field. Was I was so lucky to help those brilliant scientists and administrators do their job more efficiently by managing the IT and the IT teams. But I mean, like I said, I still was drawn toward science and medicine. Always thought about going back to school again for public health. But I guess maybe like 2017, 2018, was hanging around with some people that were population health practitioners in the state of Maryland for insurance companies, really, I mean, doing inspiring and exciting work with patient-centered medical homes and with care coordination. And that started to open my eyes to things. And then we get to 2019, 2020, a lot of social unrest here in the US. We have the COVID epidemic, and I'm just getting really bothered by the disinformation and the misinformation that's out there. Again, that social unrest, one of those epiphanies in life where I realized that, yeah, Steve, you may have worked hard, but you've had a lot of advantages in this world, and that's unfair. And I just want to do something about it. So all those things came together and said, you know what, you need to do population health management. Yep. And that's why I'm here today.
That's very helpful. Can you tell, and I think you guys started talking about this a bit, but why you chose population health management as the program, and why specifically you chose Johns Hopkins Bloomberg School of Public Health versus other population health programs that may be out there?
Yeah.
And Becky, why don't I start with you?
Okay, sure. Population health, it didn't just come to me. I was actually truthfully just searching through a number of different like public health and population health programs, because I realized that I wanted to return to school, because I want to be able to affect more lives, but I don't think I can do that within the constraints of nursing. And I felt that I needed to move outside of nursing and take my experience that I have in nursing, community and clinic, and put that to work to help foster more well-being in the community. I feel that we focus so much on the medical encounter, and that's just such a small sliver of what's actually happening in a person's life that's contributing to their health and their wellness and their overall quality of life. And so I really started looking into population health because I didn't think that public health per se was fitting my interests. And when I spoke with so I reached out to University of Wisconsin, and I reached out to Johns Hopkins, and Johns Hopkins called me, a human called me. And I think that made the biggest difference for me. My alma mater sent me a letter, an email back, but I got a call from a person. And so, I'd be lying if I didn't say that the esteem that Johns Hopkins holds didn't draw me to it. I never thought that I would be able to attend Johns Hopkins University. I'd always held it in the highest regard. And then it actually became a reality when I was able to see that, practically speaking, the OPAL scholarship that's provided made it actually more affordable than attending my state college. I just wanted to try something outside of what I've grown up with. I've grown up in Milwaukee, Wisconsin, so everything is University of Wisconsin. So it was really exciting. And I also was able to attend a virtual open house, and hearing Dr. Biddle talk about really considering health in the context of where people live and work and play, and not just within the four walls of our health institutions or healthcare delivery systems, really spoke to me. I actually was able to get a recording of it and watched it with my husband, and he was like, Becky, this is everything you're always talking about. So it really spoke to me professionally and personally, and logistically, practically, was made the most sense for me.
Great. Yeah. And Steve, how about you?
Yeah, I mean, really, I had that experience with a practitioner in the field that really opened my eyes. And the just that was the big thing. That's what said that you need to do population health management. And I knew I'm also mid-career, so I mean, as much as I want to give back and help out and do the good work, I mean, I can't start over from scratch. So I mean, I knew that I could still stay in biopharma in my company, and we have a whole social business innovation group, so I can apply these skills over there. So that's why I chose the program. And I mean, the reason I chose Hopkins was for a few reasons. Again, I mean, I am mid-career, and I can't start over, and I'm sure I could work hard and get a good education at other schools, but I mean, I needed to say that I am in the #1 school for public health for the past 20 years, and one of the best population health programs. And I needed that. And if I couldn't get into Hopkins, I thought I was well credentialed, and if I couldn't get into Hopkins, then I would think about what else, some different path for my life. So I mean, it was, yes, the reputation was a big thing, but also that this is a Master's of Applied Science program. And yes, you'll learn about laws, and you'll learn the history of hospitals and insurance companies. But I mean, I mean, all of the professors are practitioners in this field. All of the, I mean, and a lot of it is asynchronous work. It's online and you get it done whenever, but we do have regularly scheduled live talks, and you're talking to practitioners in the field, and not just practitioners. I mean, yes, there's a lot of great stuff happening in Maryland with care coordination and with Medicare waivers and things, Medicaid waivers. But I mean, you're hearing from practitioners in Maryland and in Baltimore, but across the country as well. And then everybody I mean, the people from the class, I mean, all come from different backgrounds as well. I mean, yes, some of your colleagues will be they're post-bacs, they're right out of undergrad, and they have that kind of experience to give you. Some of them are practitioners in the field for a while. There are healthcare executives in these classes as well. So, I mean, that's another reason why I chose this program.
Mm-hmm. Yeah, that's great. And I know, so Becky, you're almost completing your first year. Steve, you're almost done with the program. What would you sort of tell people who are considering applying in terms of kind of things that you've experienced, or kind of pluses, things that you maybe didn't expect from the program? Becky, you want to start?
Sure. I didn't expect to feel so much of a part of the university. I thought being here, you know, in Milwaukee, a different time zone, a Midwesterner, that I would be kind of, you know, I didn't expect to feel so much a part of something. And I think a couple of the things that I really would highlight as you're considering the program to think about is the onboarding that takes place before the classes even start. There's so much information to teach you about the culture of the school, the expectations of the school. If you've been out of school for a number of years, if it's been a long time since you've been either, you know, from your undergrad or from other graduate work, there's a lot of kind of refreshers to help you remember how to properly cite papers. You know, so some of those things I was a little worried about. I was like, oh, I don't know if I'm going to remember APA format, or, you know, things like that. There was a lot of really great onboarding leading up to the first day of class. And then since then, the live talks, like Steve mentioned, really help you feel connected. You get to see your professors or your instructors and your classmates. And I think the other thing that really I was a little bit concerned about as I was thinking about applying was the quantitative experience. I didn't have as much quantitative experience as I thought I probably should have. And I just completed epidemiology last term, and I'm currently in statistics. And I will say that the support that they provide to you is so robust. There's a robust TA team for both courses. And they provide a lot of TA office hours, and a lot of students don't take advantage of that. So if you do enroll in the program, I would highly recommend going to TA office hours, because I thought I wasn't going to be able to get through epidemiology. And I started working with the TAs, and I ended up doing really well in the class and actually understanding it. So, and when I would go to these TA office hours, a lot of times other students weren't taking advantage of it. So it was almost like having a one-on-one, I mean, it was like one-on-one tutoring. So I think that there's so much support, and there's so much connection. There's a lot of connection. And when you don't have the live talks, there's the discussion boards, and there's different study groups that kind of align with each other. And so that's been a great experience for me.
Great. Steve, how about you?
Yeah, I mean, I'm going to echo both those sentiments. The connections feel, I mean, they're really there. And I mean, it's not just participating with the cohort online or chit-chatting over live talk. I mean, we're communicating over Teams, over LinkedIn. The cohort's still pretty close, but the people on which I had a group project with a couple terms ago, we're sharing papers back and forth that spoke to the themes that we were writing about that day. So yeah, I mean, I really like that experience. And then the support is incredible. I mean, there has not been an instructor, a TA that they've all responded to my queries in a very timely fashion with very helpful information. There are there's usually office hours scheduled. Instructors also say, hey, just hit me up for when you want to have your own office hours. And yeah, I mean, even outside the classroom, there's just so much support. Very robust technical support team. The OPAL office is answer my questions as well. Even when I've had to talk to the registrar, always got straightforward answers very quickly. And I mean, you are prepared to succeed. You're set up for success. There is that onboarding to begin with, and some other things. So those were probably the most pleasing aspects. The other thing I want to note is that I guess I was kind of, I don't know what I was thinking, but I guess I'm kind of surprised. But this, I mean, if you work hard and you like this stuff, you can do this even as a working adult. I used to get C's and D's in undergrad, but now I'm doing this while working full time and raising 2 children, and I understand the material, and my academic performance reflects that. So, I mean, yes, think about this critically, and if you have doubts, I mean, talk about that. But this, you can do this, and the support is here for you if you choose that.
That's great. Yeah, and Steve, you mentioned that this is really an applied program, and its focus is on applying what you learn to your job. Can you talk a little bit about kind of some of maybe the tools that you've gained from the program, maybe some that you've applied?
Yeah. So I mean, that's, again, I'm trying to move into this space. So as I've been networking with people, I've been able to talk the talk and walk the walk with them, and being able to talk about the different kind of surveillance tools and stuff that we should be looking at, trying to help them make partnerships with the best vendors to build out their social determinants of health database and dashboard. So it's really given me something to talk about with people, and really just again, having the hearing from these people that are in the field that are practicing this every day, and say, you know what, this is how we learn about it in class. This is what we wrote the case study. They are, you know what, this is just like the clinic out there in the Midwest, that they're experiencing this challenge to talk to this disadvantaged population. Why don't we try this as well?
That's great. Yeah. And Becky, how about you? Are there certain skills or tools that you've gained that you've started applying? I know it's just halfway through the program, but what do you think?
Definitely. So it's really interesting because as I made this decision, there have been some changes on our team. So where I was really focused on transitions of care embedded at a hospital right in the center of Milwaukee, our corporate leadership has made some changes in how we were rolling that out, or how we were working in transitions of care. And so we've actually pivoted to having more of a team focused on chronic disease management and population health. And so I've been able to help informatics, population and consumer health informatics was a real eye opener for me. And so I was able to actually help recently like stratify, we're a payer, so we have claims, we don't have labs, and we're trying to figure out how can we impact most quickly with our limited resources, our members that are really struggling to manage their diabetes. And so I learned about medication possession ratio, and I was able to work with our analysts and pull a list of our members that have had lower MPRs and be able to kind of come up with stratifying around this group of 1,600 members. We only have 4 people to do outreach. So how are we going to target those and use our resources most effectively? I've also been able to lead discussions with our teams that have been resistant a bit to change, because change is always hard. And so focusing a lot on HEDIS and outcomes and value-based payment and what that means for changes in our practice and care management and care coordination. And so I've been able to really be a voice from within the team to help them understand the broader changes in our healthcare delivery system as a country, and how different laws. So I've been able to use a lot from first and second term courses to help educate my peers so that they have a better understanding of why we're making these pivots.
Excellent. That's great. Well, I want to sort of stop there and kind of open it up to the folks who've joined this call to ask any questions, share any of their experiences. And before we start opening it up to, I also wanted to make sure that I introduced Morgan Fredericks, who you'll see as OPAL office on the screen, but she's works with our admissions team on the program, and you may have had contact with her already. But with that said, does anyone have any questions for Becky, for Steve, for myself? And you can feel free to either raise your hand, or if you're more comfortable using the chat function on Zoom, you can send a question that way as well.
While people are finding their courage to speak in front of a group of strangers, which isn't easy, but something you get used to at Hopkins anyway. We do that a lot. I will just piggyback on something that was mentioned earlier, I think by Becky, that so I teach in the program, not in the population health management program, but I teach a second level epidemiology course that you two, Steve and Becky, don't have to take, but students in other MAS programs take the intermediate epi course. And having taught that course as well as other epi methods courses at the school for a long time now, I will concur that TA office hours and faculty office hours are probably the least utilized resource that we make available. For some reason, I don't know if it's scheduling or shyness or people forget, but there's an awful lot of folks who are available and just sitting on Zoom waiting for people to come and students to come and ask questions, so that no one will feel like they're left kind of floating out in the ether with their questions and not really having resources for getting them answered. So certainly that's something that we in the program strive to provide as much as possible, is lots and lots of opportunity for questions, because that's science, right? That's research. That's how we learn, is by asking questions, trying things out, getting them wrong, making a mess, and then cleaning it up. So so we are here for you.
point. Great point. So we did get one question in the chat from Kirti. Can you talk about your experience with group work, including timing and workload? And what advice would you give about staying organized during the classes and work?
Now that's an excellent question. I guess I'm a little introverted and extroverted, so I definitely prefer being the individual contributor and working on my own things. But every single group project here has gone very well, and it's been easy to communicate with people and schedule our meetings. The instructors have done a very good job of creating diverse teams, but putting people in the same time zones, even people that are not in the U.S. So that has helped. And I mean, it's 2024, so this is all a little easier. 2023, I'm sorry, but this is all a little easier. But I mean, Hopkins gives you everything you need to collaborate online as well with Teams and Zoom and such. And yeah, I mean, everybody that I've been on group projects with have all been working adults. We've all had priorities, but we've been flexible with each other. We've set each other's expectations. We've been able to set personal boundaries, but we've been able to meet up and get our work accomplished. So definitely much better group experiences than I've had in the past.
Great. And Becky, how about you?
I would say the same. I would say better group experiences, I think, because of the individuals that are in part of the program. You know, we're all working, we're all professionals, we all have had to work with other people. So it's different than doing, you know, group work in your undergrad experience. I would also say too that there was more group work in the first term of the first year than in any of the other terms so far. For the first term group work, we're provided with a really good template for who's going to be held accountable for what portions of the project. You know, what are the planned meeting times? What are the expected ways of communicating? Not everybody has Teams, so Zoom works better sometimes for some than others. So being able to have, you know, the first part of that group project was ironing out those details, which I think was really helpful for framing the project over the course of the term. And as far as how much time, it feels so long ago now. I haven't had a lot of group work since first term, but I think it's reasonable. It's set by the group sets the tone and makes those decisions together.
Yep. And I think Kirti's also asking about about work-life balance or work-studies balance and kind of how you manage that and how that's worked out for you.
Mm-hmm. I mean, there are some classes that are very, very rigorous. I mean, I think I'm spending it. I mean, some classes I'm spending at least 9 hours a week on that class. You're trying to take 2 classes at once. So, I mean, sometimes that's 15, 20 hours a week. But other times it is more manageable and maybe it's 3 hours or so. And that's just to go through lectures and reading and individual assignments. I will say this, every class I took though, that last week before it ends, that at that point I had no work-life balance. It was Hopkins took over everything there. And I mean, I did have to reprioritize things in life, and things went on the back burner as I try to get all that work done. But it definitely can be done, but it's a lot of work.
Yep. How about you, Becky?
Yeah, I would say I was really intimidated taking full-time load and working full-time. I do feel that I have a lot of support from my employer, so that helps. I have taken planned days off. I finally learned by the middle of the third term that I should just take a vacation day the first day of the term. So I think if you can plan some, planned time off to be able to just really dedicate to studying that can make things easier for you. I have a young child, so he's in scouts and his school has a lot of things happening and I want to be part of his life. So I have worked it out with my employer that I'm able to take a half day here, no, a day off there, and I'm just using my PTO here and there to make life a little bit easier, but it's a lot more manageable than I anticipated. And I did work as I was finishing my bachelor's in nursing. And I have to say that that was a lot more difficult than this. I do feel that this program really is designed for people who are working in this, working in the field in some regard. So I do feel that it's been a lot more manageable than I anticipated.
And I was intimidated as well. In fact, I kind of just dipped my toe in the water and I applied for the graduate certificate in population health management first. And I got accepted into that program and took those first year classes and got that cert and said, halfway through that, I knew that this was for me and I could do this and the support was there. So then I applied for the full master's degree program.
Great. Other questions from those participating?
Hi, I just wanted to come on. I don't actually have any questions because Becky answered every single one of my questions. And Stephen, thank you for your input as well.
You're welcome.
Coming from, I work as a nurse here in Washington State, also with a community that's very strongly affected by social drivers of health. And I think I was going down my list of questions as you were talking and you just knocked down each one. And so I just wanted to thank you both for your time today. I'd say I came in kind of 90% sure that I was going to be applying to this program. And I think after today, I definitely will be. Just a little bit of background. I never thought I would be interested in anything like population health or more of like a management or other type of program other than like public health, because I think that's all I kind of knew of in the past. I knew I was really interested in health equity and, really helping those disadvantaged populations, and didn't really know that there would be other ways to help. And as I started exploring other programs and started learning more about advanced payment models and how that impacts care so strongly, I think that's how I stumbled upon population health. And I'm really excited, I think, to be learning a lot more. There's a lot of changes going on, even in Washington. And I think one of the big things that I'm seeing, even in our day-to-days of how payment models affects everything. Our state healthcare authority had just recently rolled back PMPM payments and went back to fee-for-service for our Medicaid patients, which has dramatically changed how we see all of our patients. I work at a FQHC, so 95% of our patients are low income, and many of those are on Medicaid. And that's all. I'll kind of stop it there. I'm excited to hopefully see you guys in the program later in the fall.
Great. Thanks for sharing that. We really appreciate that. I'm glad to hear it.
So there's just discussion in the chat, Dave, about volunteer work and whether that counts.
Yep.
Work
Yeah.
And
Yeah.
my comment was, I'll let you elaborate since you're actually on the admissions committee, but my personal
Sure.
feeling is we care more about the work that you've done and less about whether you got paid for that.
Absolutely, yeah. And we do have a requirement for a certain number of years of work experience prior to the program. So you won't find students who come straight out of undergrad. And really the aim is to make sure that all the students in this program get to really benefit from the work experience of others. We talk about a lot of mid-career professionals who are in the program, and this is an applied program. So we really want folks to kind of take the work that they're doing, that they have been doing for a couple of years, grab on to kind of the tools, the education, the skills, and really start applying it to their program. So that's an important aspect of it. Of course, we look at a multitude of factors. So not just work experience, but also their personal statement, kind of why they want to get involved in population health management, what they want to do with that education going forward, their grades, et cetera, other work that they've done. So yeah, I hope that answers your question.
No, that's super helpful. Thank you. I know some places can be a bit more persnickety, if you will, regarding volunteer versus paid employment. So I wanted to double check.
Yeah, yeah.
And yeah, I mean, at this point, I'm doing program development at Planned Parenthood. So I think now I'm solidly in the related field.
Okay, great.
But thank you.
Good, yeah. And other questions or comments from folks?
Hi, my name is Jillian. I just kind of want to echo some other speakers and thank you so much for your time. Especially Becky, every time you mentioned something about your history, I was like, oh my gosh, that's me. That's me. I'm doing that exact same thing. I have that same story. I want to help people and I want to do it yesterday. And so just to hear that current healthcare professionals are going through this program successfully and then applying their learning immediately is just something that I have been looking for, and I think I've found it.
Fantastic. That's always good to hear.
I would say it's been immediately applicable. I mean, from the first week of classes, if it wasn't speaking to me like, yes, I feel so validated now, then it was giving me a lot of information and ideas to bring forth pretty much right away.
Yeah, and I'd say just as a faculty in the program, I get comments at the end of a term, and many of the students say, yeah, I applied this tool, the week after I learned it. It's been really helpful, and it's really helped us on a particular program. So it's really helpful from my perspective to hear that. It's very encouraging. So it is definitely applied, and people find value in kind of the skills that they get.
I will
Other thoughts?
say it's really helpful for me, Becky, to hear you say that as well. So that's not an accident, and we designed the program in order to have that effect, right? So I did a similar thing that you all are doing or embarking upon doing. I took my master's in education part-time online at Johns Hopkins, excuse me, while working full-time and raising young kids. And so while actually OPAL was my capstone project. So while designing the program, I was leaning on my experience, having gone through something similar and thinking, okay, this is not going to work for people who are working full-time and mid-career. This might be a possibility. And I had a similar experience. Every semester, at the end of the semester, I made a change to my course based on something that I had just learned. And my very gracious co-instructor was nice enough to let me, every semester, oh my God, you're not going to believe what I just learned. We're doing it all wrong. We have to do something else. And just let me have at it. And so I found such a thrill from being able to use what I just learned and turn around and implement it in my own work right away without having to wait for that piece of paper. And so that's what we tried to create here with the Population Health Management Program. So thank you for that validation that you felt that way, or that you feel that way.
You're welcome. Thank you. It does feel it feels very intended, but it also feels very natural and organic. It doesn't feel contrived.
It definitely feels natural. I mean, I've been through this for 2 years now, and I mean, hearing Becky and Elizabeth, they're like, yeah, this is okay. Now I see this is how everything was designed. There are so many group projects there to get you to communicate with your cohort, and we have those structures in place so you know how to do it. So, yeah, it seems so natural. I just thought that's how the world would be, but no, it was deliberately set up that way.
And just to add to what some others have said, so we do have a variety of professions in the program. So you'll have physicians, nurses, mid-level providers, people, pharmacists, administrators, really a variety. And we will try to make sure that, you know, if you do have teamwork, that you have the opportunity to work with different people, different professions. We also have folks from not just around the country, but also around the globe. We have, you know, many people, clinicians from and others from certainly European countries again, all over the world. So that's another thing that adds another sort of lens to what we're learning. Great. Any other questions? Okay, if there's nothing else. Okay, so Kirti had a chat question. I know Becky mentioned feeling like a part of the school, even from a distance. Could Becky and Steve talk a little more about those opportunities to feel like a part of the school at large?
Yes, I know we definitely can. Becky, I'll go first.
Sure.
There's just so much. So, I mean, it is what you want to make of it. Even though you're remote, and even though you may be across the country, you'll be invited to everything that students are invited to. And I mean, there are little virtual presentations that I attend, and student interest groups that I signed up for, and I check those out as well. I mean, that's definitely one of the ways I feel involved. And they also just have so many different tools set up as well for networking with other students in other Hopkins colleges, and alumni as well. So I think they do a very good job of making me feel connected.
Yeah, I would have to say the same. There are so many, so you will, I did see part of the question that I didn't answer, I think, was about how people organize their notes and things. So, you know, you will have a Hopkins email. From there, you can use OneDrive. There was a question about how to organize notes. So, you know, I use the Hopkins OneDrive for all my notes I take on lectures. So I think for me, it's being able to see all of there's the virtual happy hours. And even if I'm not there, I can see kind of the goofy puns, and you just get sort of a flavor for what it's like to be there. And then you do get invitations to attend various different speakers, different, I don't want to say conferences or webinars outside of the programs. So I think there was one where Trevor Noah came and spoke to students from the Bloomberg School, and I was able to jump onto that and see Trevor Noah speaking to us. And then of course the live talks that you have with your class, you get to see people, and they bring in, you know, you get to see people in your class, but they bring in experts from around the country to talk about the ways that they're making changes in their organizations. And so you get the opportunity to go outside of just the classwork and actually hear from experts out there doing the work. And that's really, that helps you just feel connected to everyone.
Thank you. Liz, did you want to comment?
Yeah, I just, thanks. I just wanted to jump in from the school perspective, just to answer the same question about being part of the community. There are lots of things that will speak to that. So one is just to let you know that students in this program, to us, it's a Johns Hopkins program. The fact that it's online is just a method of delivery. We don't consider the students any differently or any less part of the student community here at the Bloomberg School or at the university. So you'll be, as an enrolled student, as Steve and Becky know, you'll be on the student email distribution list that all 2,000 Bloomberg School of Public Health students are on. And so you'll receive all of the notifications for all of the activities along with everyone else. So while it's true that there will be some that are held in person, the silver lining, if we can be so bold as to say there's a silver lining as a result of COVID, I don't really feel comfortable saying that, but I have said it before and I'll say it again, that one silver lining that I've noticed is for OPAL, because so much more is now online, whether it's in real time or just recorded and made available, because we know that there are people even here in Baltimore who won't or can't attend in person. And now that COVID has lightened, I won't say gone away, but has lifted a little bit from our lives, and we're not in lockdown anymore, that hasn't really changed. So as a result, I think that the students in these programs feel that even more at Hopkins is accessible to them now than was the case, say, 4 or 5 years ago. We also have a representative to the student assembly as part of the OPAL program. So we are very much, our students are very much a part of the student experience here at the school. We do try to hold some OPAL-wide online sessions. So there are live talks that are particular to a course, but then there will also be some programmatic live talks where it's relevant just to those in, for example, in population health management, but not tied to a specific course. And then my team also tries to hold maybe a couple times a year some online sessions that are for all of the MAS programs. We're currently talking about resurrecting a program that we had paused for a little while, but it's called OPAL Coffee House, where we it's like the online version of meeting up at the coffee house. So everyone just kind of comes and it's an opportunity to vent or chat or, you know, connect with each other. And because it's hard to just mingle on Zoom, because really only one person can be talking at a time, what we've done is invite guest speakers who have something to say that might be relevant no matter which MAS program that you're in. So for example, we've had representatives from the Office of Student Life come and talk about things that we were just talking about a few moments ago, like work-life balance and time management and those kinds of skills that are helpful, especially to those of us who took a long time off since the last time we were in school. And maybe it's not even relevant anymore because the last time we were in school, we were a full-time student. That was our job. And now we have 25 other full-time jobs that require our attention. At the start of COVID, we had the program director of our program in patient safety and healthcare quality, Dr. Albert Wu, who's also a practicing physician here at Johns Hopkins Hospital. He came on to talk about what the experience was at Johns Hopkins Hospital with regard to COVID. And that was really moving people. Just, you know, this was in 2020. So you remember what things were like then, and everyone was just completely on edge. And so people just started opening up and sharing their COVID experiences, whether they were professional experiences or personal experiences, with complete strangers, and it just became a really, really moving, powerful session. So we try to have online sessions for everybody in order to maintain our community. There are skills out there that I researched when we were putting OPAL together on how to build and maintain an online community. And so we try and do some of those things. And I will tell you, Steve and Becky, you can look forward to this, that when graduation time comes, all of the graduates from the MAS program are invited to participate like anyone else. And even though you're scattered all over the globe, a large proportion of our students actually do come to Baltimore to attend the graduation ceremony because of wanting to, you know, feel that connection. And so what we typically do is host a reception the evening before. We have a cocktail reception just for the OPAL programs. And it's an opportunity to, you know, see people in person for the first time, connect with your fellow classmates, connect with your faculty. And the evidence that I get that our attempts to build an online community have been successful is what I see when I stand back at that reception every year and I just watch people enter the room, and the hugs and the smiles like they're greeting long lost friends are just, it sounds corny, but it's completely genuine. It's so heartwarming and it's so moving. And it really does show me that people have made real human connections with each other and become not only part of each other's professional network, but also friends through the program. So we're looking forward to that again in about a month.
Yeah.
I already have plans to meet a friend I've made. And my
Excellent.
family wants to come out. So we know we're going to Baltimore
That's great.
next May.
Great. Other final thoughts or questions? If not, we'll leave it there. And I really want to thank everyone who's joined today for your questions and comments. And especially I want to thank Becky and Steve for their time today and their insights. Very helpful for everyone. So I really want to thank you guys. So we'll leave it there. Look forward to seeing your applications. In the meantime, if you have any questions, please feel free to reach out to us and ask. We're more than happy to answer them. So any final thoughts, Liz, or?
I was just going to open it up to Morgan. If there's anything, Morgan, that you'd like to say. Morgan is your go-to for application questions.
Yeah, thank you so much, Liz. So yeah, I will be reaching out to all of you guys after our session today, just to touch base with you, see if you had any questions about the application process, as well as send you the recording so you can watch it later if you like, as well. So thank you all so much for attending today.
Thanks, everyone. Appreciate
Thank
it.
you.
Bye-bye.
Thank you. Have a great day. Bye.
Thanks.